Anyone who has experienced a sudden vaginal flare-up knows the feeling. It is an agonizing, inescapable burning and itching that demands immediate relief. The immediate reflex is almost universal, a quick trip to the pharmacy to grab an over-the-counter anti-itch cream. But grabbing the first box on the shelf often backfires. Misdiagnosing the cause means the treatment won't work, leaving you to manage the same symptoms for several more days. The vaginal environment is a delicate ecosystem. It naturally maintains a highly specific balance between different strains of bacteria and trace amounts of yeast. When that balance tips, you get an infection. But an overgrowth of bacteria requires a completely different medical intervention than an overgrowth of yeast. Successfully resolving the infection means you have to accurately identify exactly which side of the microbiome has taken over before you spend a single dime on medication. This matrix breaks down the vaginal microbiome to help differentiate between bacterial vaginosis and a yeast infection. We look at three main indicators: discharge, odor, and pain. First, the physical discharge. With bacterial vaginosis, or BV, the discharge is typically thin and grayish. With a yeast infection, it becomes thick and white, often resembling cottage cheese. Next is the odor profile. BV creates a distinct, fishy smell that usually spikes noticeably after a period or after sex. A yeast infection produces zero odor. Finally, we check the pain level. BV might cause some mild irritation, but a yeast infection triggers severe itching and a sharp burning sensation, especially during urination. If your symptoms point to BV, you have to see a doctor. BV is a bacterial issue that requires prescription antibiotics like metronidazole. An over-the-counter antifungal cream will do absolutely nothing for you. However, if you confirm there is no odor and a thick discharge, you have a clear path forward. You can confidently pursue targeted antifungal yeast treatments right at home. Once you have confirmed a yeast infection, your treatment choice comes down to the delivery method: swallowing a pill or applying a topical cream. This scorecard compares oral and topical antifungals. To decide which is best for you, we have to evaluate them across 4 criteria: convenience, local relief, systemic safety, and physical condom safety. Oral antifungals, like the single-dose fluconazole pill, score high for convenience. You take 1 pill and you are done. Clinical data also shows they have a slightly higher total clearance rate of fungal spores. But oral pills have drawbacks. Processing the medication through your entire body elevates the risk for systemic side effects, like gastrointestinal distress or headaches. And because the pill works internally, it offers no immediate physical soothing for localized burning and itching. Topical creams and suppositories offer the exact opposite benefits. They provide immediate physical soothing directly to the inflamed tissue. Because the medicine stays localized, there is near zero systemic risk to the rest of your body. The trade-off is that creams are physically messy. You have to commit to 3 to 7 days of strict application. Additionally, the oil-based ingredients in many of these creams can actively weaken latex condoms and diaphragms, compromising your birth control. Clinical cure rates for both methods are actually nearly equal. Your choice simply comes down to what you prioritize: the systemic convenience of a single pill or the immediate local relief of a cream. Fungal overgrowth is not limited to the internal vaginal ecosystem. Environment and lifestyle habits trigger external yeast infections, particularly for highly active individuals. Tight, synthetic activewear and wet swimsuits create the perfect storm. They trap a triad of infection triggers directly against the body: heat, friction, and moisture. This combination causes a condition known as intertrigo. It is a mechanical inflammation that occurs anywhere skin repeatedly rubs on skin, like the folds of the groin or underneath the breasts. Intertrigo presents as painful, red, peeling, or even splitting skin right in those friction zones. Once the skin breaks down, Candida yeast rapidly moves in. These secondary yeast infections are the primary driver of worsening intertrigo because the yeast thrives in those wet, hot environments. Treating this requires a 2-step protocol. You apply targeted topical azole treatments to kill the yeast, but you also have to physically change the environment by airing out the skin and switching to loose cotton clothing. If you skip the wardrobe change, the medication alone will not save you. Managing your lifestyle inputs, specifically wet clothing and friction, is the only way to break the cycle of mechanically induced fungal overgrowth. Once an infection is cleared, the goal shifts to keeping it away. But not all preventative habits are created equal. This chart measures the actual return on investment for popular lifestyle habits, plotting how much effort a habit requires against its actual clinical impact on your health. Let's start with douching and scented hygienic sprays. These actively strip away your protective lactobacillus bacteria and spike your vaginal pH. They take effort to use, and they actively harm your microbiome. Basic environmental control, however, yields massive returns. Wearing breathable cotton underwear and immediately changing out of wet gym clothes takes almost zero extra effort, but it highly impacts your ability to starve the yeast of the moisture it needs. Then there are probiotics, specifically lactobacillus strains. These require a daily commitment and take weeks to work, giving them a moderate impact. They can help reseed the microbiome to outcompete yeast over time, but they lack the immediate knockout power of traditional antifungals. Medication fixes the immediate problem, but relying solely on pills or creams without correcting your underlying environmental hygiene guarantees the yeast will find a way to return. There is a strict medical threshold where a standard annoyance becomes a chronic condition. If you experience 4 or more distinct yeast infections within a single year, you have recurrent candidiasis. Hitting that 4 per year mark means standard over-the-counter treatments are officially failing you. At this point, self-treatment has to stop. A physician has to investigate exactly why your body is stuck in this loop. They will test for underlying triggers, like unmanaged diabetes, a compromised immune system, or the presence of a highly resistant non-albumin strain of yeast. Escaping the recurrence trap requires intensive medical intervention. Your doctor may prescribe a 6-month prophylactic pill regimen to suppress the fungus, which will require periodic blood tests to monitor for liver toxicity. Chronic, recurrent infections act as a systemic warning light. These cases require a clinical investigation that basic over-the-counter products are not designed to provide. Navigating vaginal and skin fold health requires following a clear set of rules. This flowchart maps your exact action plan. If you have a mild, first-time infection with no fishy odor, you take the first path. Proceed with an over-the-counter topical cream or get a telehealth pill prescription for quick relief. If your symptoms do not improve within 7 days of starting that over-the-counter treatment, you move to the second path. Stop the home remedies and immediately see a doctor to test for resistant fungal strains. If you reach 4 or more infections in a single year, you take the final path. This routes you directly to a physician for long-term maintenance therapy and underlying cause checks. Yeast is a natural part of the human microbiome. Knowing when to use a cream, when to request a pill, and when to adjust your habits helps you resolve symptoms quickly whenever they appear.